I think that's the best answer I've ever heard.
That is a cool analogy, right?
Hi, I'm Thomas Clark, a family physician. I am working with Ogden Clinic in Providence, Utah, doing family medicine, but my specialty is diabetes and all things related to diabetes, which includes the cardiometabolic syndrome, and that includes things like high blood pressure, diabetes, heart failure, kidney disease, heart attack, hyperlipidemia, fatty liver disease. They're all intertwined with what causes diabetes, and that's been my passion for the past 20 years. And it's really important that the patient be involved. What works for one patient doesn't work for another patient. What's important for one patient may not be important for another. So we really should be doing patient-centered. So my job is to give the patient, give you the information you need on how to make a best decision and help guide you to follow that decision and really make you the center of what we're doing, because if the patient doesn't have buy-in, it just really doesn't work. And I really enjoy medicine when patients are passionate about getting better and getting their disease to get better, and I can very much help them when they have buy-in. And the importance of part of that is that I know all the different options, but that they feel like they're part of that option, so they buy into that. I chose family medicine because I'm very passionate about people and enjoying people and being part of their lives, but I also love science. I did chemistry as an undergraduate, and family medicine was just a combination of people and multiple different types of science to all the different things that make a person whole. Establishing care with family medicine is very important. They describe a wagon wheel, and as you come off of each spoke of the wheel, those are all your specialists, your cardiologist, your oncologist, everybody else. But you have to have someone in the middle who's holding everything together and guiding the care. And that's what I'm really passionate about with cardiometabolic syndrome. Is a person with this oftentimes is seeing a cardiologist, they're seeing a nephrologist, they're seeing a lipid specialist, they're seeing a diabetologist, an endocrinologist, and a lot of times what they're doing doesn't agree with each other, and so they're not getting good care, they're not getting a whole body care. And that's part of what a cardiometabolic clinic can do, is give all that treatment in one spot. The most rewarding part of medicine for me is getting involved in patients' life and just seeing how much better they can get, how much better they feel, and just the interaction that we have. So things that have been unique for me is that I was a principal investigator of the diabetes trial. It was my own idea and my own doing. And I learned a lot about high-risk diabetics and how so many diabetics really don't understand their disease. They don't understand the steps to be able to progress. We used continuous glucose monitors, and I'm very passionate about continuous glucose monitors. We sample them, we help people get started with them, and it really lets people own their own disease. And that's something I've been very involved with. I've nationally been to meetings on kidney disease, and kidney disease is very important, but very underdiagnosed, and so there's a lot of things I hope I can offer to patients that come see me.